All right, good afternoon. We recognize for many of you, our joint providers, that your CME responsibilities are in addition to your actual title and responsibilities of your job. We want to take a few minutes to explain to you why you have to do all this paperwork and to encourage you that it does have its purpose in providing accredited CME. We want to take you through this Prezi and talk about the process and then walk you through our joint providers website.
All right, so the process we go through is not mandated by us alone, nor by the Medical Society of the State of New York, but nationally by the ACCREDITATION and AMA. The first part of our process, the Joint Provider Agreement. This is an agreement completed online. It gives you an upfront summation of our policies. This form must be completed and electronically submitted for each application you submit. It must be submitted 30 days prior to the event start date. It also overviews the fees. We have a $500 application fee and a $100 credit fee. Please note that all invoices must be paid within 30 days of the invoice date. This is an outline of what we're going to be going over in this presentation. We are going to start out with the needs assessment, which is made up of the gap, the need, the objective, and the desired result. The gap. The gap is determining the current state of knowledge or practice. To help you figure this out, some questions to ask are, what is the difference between the actual, what is, and the ideal, what should be, in regards to performance and or patient outcomes? On the application, you need to write one short summary of the gap. The need, the educational needs that you determine to be the cause of the professional gap. Again, to try to figure this out, ask the questions, what should that state be? What is lacking? What do they need to learn or improve? And just like the gap, this needs only to be a short summary. Moving on to the objective. In response to the gap in need, the objectives clarify what the attendees will learn. Learning objectives are what the attendees should know or be able to do at the end of the educational activity. Please note that learning objectives are not what the instructor is going to cover. That would be a teaching objective. To help you better write objectives, keep these three questions in mind. What should the learner be able to do? Under what conditions? How well? The objective should always answer the first question, and they answer the next two, but do not have to at all times. When writing your objective, you should introduce the objective with, upon completion of this education activity, participants will be better able to, and then list your three objectives. So for example, you would write, upon completion of this education activity, participants will be better able to, 1, diagnose PCOS in an academic manner, 2, evaluate all the medical comorbidities in PCOS in an evidence-based fashion, and 3, determine, based on evidence, the best course of treatment for patients with PCOS who are trying but unable to conceive. All right, on this slide, we're listing verbs that you shouldn't use in starting out your objective and ones that you should. On the left are listed commonly misused verbs. Please avoid using them. If you know, understand is on this list, so please don't use that. On the right, we have a few listed that are good, strong verbs to use in crafting your learning objectives. And on the application, you need to write 3 learning objectives. You may include more, but 3 are required. All right, now we're going to move on to the desired results. Desired results are what you expect the learner to do in his or her practice setting. So to help you figure this out, ask how will the information presented impact the clinical practice and or behavior of the learner? Indicate how this change could be reasonably measured. And on the application, you need to write one short summary of this. That concludes our look at the needs assessment. We're going to move on and look at the evaluation.
We have three types of evaluation: the participant, where we would evaluate what the learner has learned and whether we met the learning objectives in preparing the event. The other is the faculty. We want to evaluate our faculty's experience working with us on planning and preparing for these types of activities. And then finally, the education director, who evaluates how well the activity met what the education director was intending to do.
On our evaluations, everything that is marked in red is to highlight for you what you need to put in to make it specific to your event. You'll find the templates for all of our evaluations on our website. For our faculty evaluation, you need to make sure that each faculty has their own evaluation to fill out. Again, everything in red is what you need to change. On our director evaluation, you'll note at the bottom that it says faculty disclosure was made. This is just to remind you that all disclosures for planners and faculty must be stated either verbally or in written form to the attendees at each event. Even if there's nothing to disclose, that must be stated. Now we're going to move on to speaker qualifications.
We need to ensure that all the people that we have teaching are actually qualified to perform that part of the educational activity. So we therefore ask for a CV. A bio is acceptable. What we need is just simply proof that the speaker is qualified. We also need to have a disclosure filled out for each speaker and planning committee member. What the point is to ensure that anybody who has control over the content in any way, shape, or form has disclosed and resolved any real or potential conflict of interest. And when you read through the form, you can see that once a conflict is disclosed, that's not necessarily exclude them, but we work through ways in which that conflict can be resolved.
Again, you'll find the disclosure form on our website. All right. To help simplify this process for you, we've come up with an application checklist. This is also posted on the website. It lists all the different forms you need to fill out and submit prior to the application, as well as all the post-activity paperwork that you need to send us after the event occurs. And I just want to remind you that we will not be accepting old forms. The ACCREDITATION has mandated new language that we must adhere to. Thus, we've updated our paperwork to reflect this, and we appreciate your compliance with this. So please, no old forms. Delete any on your computer and download our current and up-to-date paperwork off our website, which is here listed as cbmc.libguide.com/CME/joint-provider-CME. We're going to go ahead and take you over to our website and show you how that works.